morning. It's Eagle County Department of Human Services. I'm Kathy Lyons, the Economic Service Director.
And I'm Megan Birch. I'm the Department Director for Eagle County's Department of Human Services.
And why was Eagle County interested in doing business process reengineering?
Well, when we started this process, we had some major delays in getting our benefits out to our customers, which was creating a lot of hardship for the folks that needed the services, but it was also really stressful for our team to know that they had workload piling up on them and not the capacity or the tools they needed to get those benefits out the door. Around that same time, our call volume was escalating dramatically as well because people weren't getting their benefits, and so we're calling to check status and ask questions. So it was just layering on top of our workload. And then to top it all off, we had a very complicated workflow process, both for our customers and for our staff, to get from the initial application through to issuing the benefits. So a lot of tripping points along the way, even internally for our staff, that really created this mindset around looking at it as, well, we have 45 days to process an application instead of how quickly can we get this application completed and out the door. It wasn't that we didn't want to get the services to the client, but it was really how can we navigate our structural internal barriers to be able to change the mindset from we have 45 days to how can we get this done without having to touch it multiple times with multiple people. So when we had the opportunity to become a model site for the business process redesign, we really wanted to focus on looking at better ways to do things, including electronically scanning documents and having them available electronically, implementing a real call center to address some of the call volume, and then seeing if we could come up with some way of having some real-time data so that we knew where we were with some of the applications, because that was one of our tripping points as well, that we just didn't know where we were in the process with our applications.
Can you highlight any of the tools or techniques that you learned during CPIC that are still being used today?
So several of the things that we used were, first we looked at our process. As Megan mentioned, it was very complicated, not only for our customers, but our team members. So we looked at that process and made it less complicated, took out some of the double touches that we were using. We also at the time were operating under a specialist model, which meant individuals had assigned caseloads. What we found was we moved to a generalist model, which allows us to deploy our resources, meaning our team members who were doing all that hard work, to address whatever our current need was. So if we had an influx of RRRs for Medicaid, we could put our staff working on that. And so we continue to operate in that generalist model with one caseload that is shared amongst our team members. We also implemented a visual workload process. And at that time, it really was a physical, visual workload. We had all the work that had to be done out where we could see, so there was no hidden work. We've since moved to an electronic system, so now we can see it in a list on the computer of how much work, how many items we have to process. Thirdly, we moved to walk-in appointments, because what we really learned as part of this process was scheduling an interview created backlog immediately. So if you could see that customer right then and there, that work was done, and it never even made it into the waiting to be done pile. So, and we use that method still. The other thing, as I mentioned, we've recently implemented Human HS Connects, which is an electronic data management system. So that took us a few years to get there, but that was one of our goals, and we did meet that last year in 2017.
All right. And what should other counties know about process improvement or being a model site?
Well, I think one of the things that we really took away from it was understanding the whole business process redesign process and what some of those tools are, like asking why and not just doing something because we've always done it. looking at the double touches or where we waste time or waste resources in a process. So really being able to map out a process and start looking at it from a more outsider kind of perspective, and not being stuck in the way that we've done things because we've always done them those ways. So
I would say a couple of the other things were with the model site project, we were able to gain a few quick successes, so that gave us some motivation to continue doing that work. And I really think the thing that stays with us is kind of that different lens, really looking at it from the perspective of when someone walks in our office and they need to access healthcare services, they don't need to access those services in 45 days. They have a need now. And so meeting that need as quickly as we can is the best service we can provide to a customer.
So it's an ongoing process, but I think we've definitely learned tools, applied tools, and are finding opportunities every day because of that opportunity.
Thank you.